Hello and welcome to our presentation. I am Tayanan, the presenter, presenting to you My TB Companion, an integrated video observed therapy application for tuberculosis management in Malaysia. Introducing our exceptional team from University Malaya and United Kingdom consisting of computer science and medical background students and experts. Let's get to know about tuberculosis. Tuberculosis is an infectious disease caused by the bacterium called Mycobacterium tuberculosis. In 2021, it was reported that 1.6 million people died from TB, making it one of the top infectious killers worldwide. Despite significant efforts to control and eradicate TB, it remains a major global health challenge. Now let's explore an alarming fact about the challenges we face in tackling this. Do you know that 25% of tuberculosis patients default treatment every year? This means that a significant portion of individuals diagnosed with TB do not complete their full course of medication. Treatment default occurs when patients abandon their treatment. Now, why patients are abandoning their treatment? Let's zoom into the problems faced by many of these patients. So currently, in a traditional way, a TB patient has to undergo directly observed therapy short course, in short DOTS. Now, what is DOTS? It is a method of drug administration in which a healthcare professional watches as a person takes each dose of a medication, which means patients has to travel to hospital to take medicines for 6 months. However, this process is hampered by the logistics challenges. As you can see, patients have to burn 80% of the cost and traveling is troublesome and time consuming. Just see how inconvenient and labor intensive this process is. And when these constraints are not rectified, patients are unable to comply to the treatment, which leads to higher mortality rates and higher treatment costs. We found out that a failure with TB treatment has the potential to cost an additional 51 million ringgit Malaysian taxpayers' money, and this is a problem that needs to be solved. Thus, we have come together to solve this problem, and our goal is to develop a bilingual video observed therapy system to increase TB patients' treatment compliance. With that, allow us to introduce to you My TB Companion, an app-based bilingual solution to replace traditional TB touch therapy with video observed therapy for tuberculosis. A video observed therapy is a method that allows patients to video record the medication intake, which the healthcare provider can watch at a later stage. Now, let me show you how exactly that will be done through our app demo. Presenting our prominent feature of our app, which is video uploading. After logging in, patients take a video of themselves taking the daily medications and upload it to our platform. It is as simple as that to implement video observed therapy, which provides great convenience to the patients. Next, patients are able to report any side effects from their medications by just selecting from the list of side effects, which allows the healthcare workers to follow up right away. Our app also provides a feature where it automatically records the days that the patient have taken the medication and the days that they have not. It presents in a calendar format for easy tracking. Last but not least, patients can now easily book appointment if they would like to seek consultation with our doctors. Now let's jump into the healthcare module. Firstly, they can approve the video uploaded by patients. Secondly, the healthcare workers are able to review side effects reported by patients and follow up with them. Lastly, they are able to manage the appointments and attend video call as well. To sum it up, this is our entire workflow of our app. In short, no hospital visits, no travel needed. Just take pills at home and upload video daily. With that, we are proud to say that we are unique as we are the first in the country to offer bilingual video observed therapy to mitigate the problems faced by the TB patients. Furthermore, we do offer more features for a complete experience of healthcare service right at their fingertips. With our app, users are able to greatly benefit as now there will be reduced hospital visits, which leads to higher compliance rate and patients can save huge amount of cost and their time. All in all, more convenience to the users. Not to forget, our healthcare workers are also able to benefit from our app as they are now able to monitor them remotely. This leads to reduced risk of exposure. Lastly, there will be enhanced productivity as they can save their time as well. To the society, My TB Companion increases the accessibility to healthcare, especially for undeserved and vulnerable community, because now all they need is internet connection and phone. Furthermore, we are now able to reduce the emission of toxic gas, and government is also able to reduce and minimize its expenditure on TB treatment. Here's how our ideal beneficiary looks like. Our market research also shows that most of the patients and TB medical staff do agree to use My TB Companion. Here is our market size. We are confident that we are able to reach up to 32 million patients across Malaysia. Here is our plan to get revenue. Our idea has received various different recognitions, including copyright publication and grants from few organizations. We have also won several competitions in the past years as well. Not to forget, our initiative is currently supported by PwC through the UK Research and Innovation Development in ASEAN Fund. Lastly, let's embrace My TB Companion as a powerful tool to overcome logistical challenges and work towards a future where TB is eradicated. Thank you.